Okay, so hello everyone. Today I'd like to share with you our experience regarding the use of hyperCL contact lenses in the treatment of bullous keratopathy. For a short introduction, the cornea is the most anterior transparent part of the eye. Its correct structure is essential for the visual process. It is also a tissue that has an extensive sensory nerve fiber network. Thus, its damage results in severe pain. In the case of corneal edema, the passage of light is limited and the visual acuity decreases. There are many causes of corneal edema. The most important one is the failure of the endothelium, with most common Fox endothelial corneal dystrophy that occurs mostly in the elderly population and is caused by the endothelial cell count decrease and the presence of corneal guttae. Other causes of corneal edema include cornea fail after the eye surgery, eye trauma, acute glaucoma, and chronic inflammation. As to bullous keratopathy is the end stage of corneal edema. The natural progression of the disease includes loss of corneal endothelial cells, presence of corneal stroma edema, followed by visual acuity drop. With the overhydration of the corneal stroma, the epithelium becomes edematous and formates painful blisters. As to the treatment of corneal edema, we can divide it into the conservative and surgical. As for the conservative treatment, it is generally reserved for less severe cases, and it is based on the hypertonic eye drops and ointments. As for the surgical treatment, its objective is to replace the dysfunctional endothelium, as it's the case with the testament membrane endothelial keratoplasty. However, still the penetrating keratoplasty remains the golden standard. There were few reports describing the spontaneous corneal clearance after the graft was displaced. Therefore, there is a possibility. It seems that there is a possibility for endothelium cells to multiply after all. So in 2014, Goldberg presented characteristics of non-surgical and surgical patients of Fox endothelial dystrophy, and he found out that nearly 80% of patients did not undergo any corneal surgery. Therefore, the majority of patients with corneal edema will stay in the conservative treatment for many years. Taking this into consideration, any optimization of conservative treatment would be most welcome. And the ION Medical aims to fulfill this task with the introduction of hyperCL lenses. These lenses are specially designed to enhance the therapeutic effects of hypertonic eye drops used topically in corneal edema. The central area of the contact lens is protrudent, elevated, and thus creates a space between the contact lens and the cornea that serves as a reservoir for hypertonic drops. The University Clinical Center in Katowice has the privilege of participation in clinical study conducted by ION Medicals that aims to assess the treatment efficacy of hyperCL in corneal edema. Those are inclusion and exclusion criteria. Generally, we were searching for patients with chronic corneal edema that lasts more than 3 months. The study is prospective, open-label, multi-center, and randomized crossover, meaning each subject will undergo 2 types of treatment, one with the hyperseal and the other with regular soft lenses. In Katowice site, the study group, as for now, contains 20 patients, including 2 dropouts due to lens intolerance that happened within the first 24 hours. And I would like to say that the one person was using the hyperseal, while the second person was using just the regular soft contact lenses by Bausch and Lomb. 61% were female, mean age 67 years old. I will just show the basic results, and then I will go for the description of individual patients. And so for the mean best corrected distance visual acuity, this is in a Longmar scale with ETDRS charts. There was an improvement by 2 lines, and there was also an improvement in corneal central thickness from 739 to 725 micrometers. And as to the individual cases, first case, it is also the first participant of this clinical trial, a 48-year-old female teacher with bilateral Fox dystrophy. This is her left eye. Prior to treatment, the corneal thickness is 927 micrometers and visual acuity 0.3, but this is in Snellen's chart for distance. As you can see, the cornea is on the LCT scans is irregular and edematous, and after just 7 days of treatment, the corneal thickness dropped to 763 micrometers, and the visual acuity improved by 2 lines. Recently, I met with these patients around 1 month ago. I was hoping for her to participate in the study once again, but the criteria have been tightened, so she wasn't qualified due to good clinical condition. As you can see, the contour of the cornea is normal. The central corneal thickness dropped to 588 micrometers, and the visual acuity is 0.6 in Snellen's chart. The patient is satisfied with this result. She knows that this is not a 100% visual acuity, but she reports no blurry vision.
How long time after the?
Well, actually, after she finished participation in this program, she received 3 boxes with 6 lenses. It was given to her for free by IO Medical, and she was using it after she finished the participation in the program. And this scan is taken around 1 year after. She wasn't using those contact lenses after she noted that there was no blurry vision anymore. But she told me that she still keeps 1 lens just to be safe. In case. So at this point, I was actually wondering if she actually has the Fox dystrophy. So at the same time, I took scan, and yet, as you can see, this is got at the endothelium level. So the case 2, 81-year-old female, also with Fox dystrophy. This is her beginning OCT scan with 894 micrometers, visual acuity 0.02. After 1 week of hyper-CL use, the corneal thickness dropped to 825 micrometers, and the visual acuity improved to 0.2 in Snellen's chart, so 10 times fold. And the cornea is slightly less edematous, and well, actually, despite this patient was actually outside of the clinical study, and she didn't receive any free contact lenses, and she didn't continue the treatment. And generally, I think that it is mostly because of her vision in her second eye, which was still better, 0.5. So I guess it was enough for her daily routine. And it was already mentioned yesterday that it is good to begin with the treatment with the better eye, to make the patient more likely to continue the treatment. So the case number 3, unfortunately, this was less effective. The beginning corneal thickness was 633 micrometers, and after 7 days, she reported with pain and drop in visual acuity, 0.1 in Snellen's charts, an increase in corneal thickness. I asked her if she rubbed the eye or that anything happened to her. Also, in the slit lamp examination, the contact lens was perfectly stable in place. So I'm not sure what exactly happened. Maybe just lens intolerance. After fluorescein installation, you can see there are 2 areas of corneal erosion. It was managed with the topical treatment, and maybe the problems with the lens intolerance can be at least partially addressed because the contact lens undergoes evaluation when it comes to its design. So, for example, Ion Medical has improved already the thickness of the contact lens edge, so maybe it will increase the lens tolerance for the lens. And the last patient I'd like to share is 70-year-old female, a surgeon, general surgeon, that experienced corneal fail after the phacoemulsification. He reported with 770 micrometers, and after 1 week of treatment, it dropped to 750 micrometers, and the visual acuity has improved. And I asked him if he feels that is there any improvement for him. So he replied that I can drive 160 kilometers per hour on the motorway. Therefore, I believe there is an improvement. So, in conclusion, the hyper-CL is an efficient medical device for corneal treatment, corneal edema treatment, and I believe there is a need for a longer observation period. That 1 week should be like an initial trial to check the lens tolerance and patient compliance. And of course, I'm looking forward to similar studies, especially those concerning the corneal infection. So thank you for your attention.